Kenya has identified community health units under primary healthcare as the foundation of the country's ambitious mission to achieve its universal health coverage. Significant achievements have been realized in healthcare service delivery since independence, resulting in improvement of various health indicators. However, Kenya is now faced with the burden of communicable, non-communicable diseases and injuries from traffic accidents, among other health needs. At Healthy Entrepreneurs, we believe in basic health care for all. We offer improved livelihood opportunities for empowered community health workers to provide affordable quality care and improve the health and well-being of underserved communities. Healthy Entrepreneurs has developed a model that complements health services offered at county level, where existing community health workers are recruited, trained, and supervised by the local government and healthy entrepreneurs. The training enables them to offer a wide range of health services delivered at the doorstep of the rural populace.
At Health Entrepreneurs, we ensure that the CHP has been equipped with the right information, the right materials, and the right tools to deliver the work. The trainings that we do after recruiting the CHP, we do a 5-day training that equips them with the skills, the entrepreneurial skills, the technical skills, and most importantly, the basic skills that are key for them to deliver the service at community level. So at the end of the day, we ensure that the services that are offered are of quality and are of key as per the set guidelines that are there.
The community health workers are given an opportunity to build their own social and sustainable business after receiving training on entrepreneurship, financial and digital literacy, and screening of non-communicable diseases. This is then coupled with regular refresher trainings based on the community health strategy technical modules, access to the range of health commodities anchored on the technical modules, regular replenishment of stock, and access to finance. Once a community health worker is onboarded into the program, there is close supervision and monitoring to ensure adherence to the guidelines prescribed in the Primary Healthcare Act. Community health entrepreneurs who have aptitude for entrepreneurship, increased households within their catchment area diligently, and submitted reports to their supervisors on time are offered additional training on our telemedicine solution, e-dispensing.
How does e-dispensing work in the community? So we have trained community health promoters that have been trained on both diabetes and hypertension, and these CHPs are able to create awareness, sensitize and mobilize the community, where they are able to identify people who are suffering from hypertension and diabetes. Once they identify somebody that is suffering from hypertension and diabetes, they can be able to connect the client to a doctor from a distance, where we have a virtual clinic, a registered virtual clinic with the medical team. The clinical team is able to do phone consultation to the client and evaluate the client and be able to arrive at a diagnosis. Once we have a diagnosis, the clinical team is going to do a prescription to the client. This prescription is going to be sent to the pharmacist, where the pharmacist is going to approve the prescription and send this prescription to the CHP via a phone.
I'm Okumuros, a community health entrepreneur from Kisumu County, Seme Sub-County, West Seme Ward, Manywanda Cluster. I'm manning 100 households, taking care of 20 NCD clients, patients. E-dispensing has made my work easier because it links me with my clients and together with the doctors, so I don't need to spend a lot of time walking up and down. I just visit a household and my clients get linked with the doctors, then they are given their medication, I do the scanning, and then I'm done. To the clients, it has reduced costs. Like initially they had to visit the health facilities, and most of the clients come from far distances, so they had to spend a lot of money on transportation. But now we visit them and give them medication in their households, so it has reduced costs, and then they are able to get the drugs whenever they need them, because in most of our health facilities there is a drug called out of stock. So with us in e-dispensing, we are always equipped with all the drugs all the time. So we make sure that all our patients are refilled every month without missing their drugs. E-dispensing 1, we have the client, then we have the HE toll-free where we have our doctors, then we have myself as a CHE. So when I visit a household, I first introduce myself. After introduction, I take the vitals. After taking the vitals, I call the HE call center. Then thereafter, the consultation between the client and the doctors continue from there. And then I also do defaulter tracing. We have some of our clients who had been put on medication but dropped or defaulted. So I do a follow-up, I trace those defaulters and then bring them back to the system and reintroduce them to our system of e-dispensing. And then I start giving them medication.
What we do at the pharmacy level to make it happen. First of all, the general idea is to ensure that the standard of care that we offer to our clients is of good quality, and with that, together with the team members, we've been able to develop SOPs derived from the national guidelines to be able to guide step by step of what we do to make it happen. When I talk about the processes, so I think the foremost is procurement. So in regards to procurement, we ensure that we buy quality brands that have been licensed for trade by the PPB, after which the whole idea on GDP, I think, take course to ensure that we preserve the efficacy of the medicines up to a point where they reach the client. So once an e-prescription is there, it is our work to check that it corresponds to the needs of the client and also that it is safe for them to use. So once we approve that, we will then depend on the CHE to be able to deliver that medication to the client, and of course they rely heavily on the app to be able to scan the QR code, which then helps them to identify the right drug attached to a prescription that was written. Now, whenever the CHPs have delivered the package to the client, it would be now our work to also try to talk to the client to give them the specific instructions in terms of what they need to do. Once the QR code is generated and attached to, stickered to a package, it is in the discretion of the client only to be able to break that seal. So no one else can break that seal, including me and even the CHE. Besides that, I think the other part is on pharmacovigilance, so which is basically patient safety. So of importance is that we should be able to track specifically adverse drug reaction if they occur and whenever they occur. So part of what we train them is the specific adverse reaction that we expect from either the hypertension or diabetes medication, and what to do. So basically, whenever they happen, a client should be referred as soon as possible to the nearest link facility.
Our clients receive weekly follow-ups depending on how the clients are. We are able to classify the clients, and we have clients that we monitor after 1 week. We have clients that we monitor after 2 weeks, and then we have clients that you are able to monitor after every 1 month. So we make sure at least once a month our clients have been reviewed. When we have any other complication and we need any form of a confirmatory test, we are able to link with the link facilities and we refer our clients for additional tests. We review our clients every month. Then after 6 months, we are able to review all our clients and do additional tests that are required to be done for an NCD client.
There's an increase in the number of clients who are currently on management. And number 2, our workload at the facility, the medical outpatient clinic, the numbers are reduced since most of the stable clients are being seen at the community.
We have these clients who need much attention. We have those clients who I need to visit. Like, for example, when I take the vitals, maybe somebody has a high vital, so this person needs close monitoring. So most of them I do 2 days, after every 2 days, and some on a weekly basis. But all these other steady clients, I visit them once a month. Most of them I meet in a cluster meeting, on our meeting day of support group meetings, and on the day of refill. I do a refill on a monthly basis, so I visit them every month. But these other ones who need close monitoring, I visit them after every 2 days or on a weekly basis. My clients have a peer support group, which was created 3 months back, but now they have started embarking on projects. They have started on farming, and they are also keeping poultry. To the clients, most of them share their ideas there. They support themselves financially, emotionally. When they attend these peer support groups, they share their experiences and they support each other.
Healthy Entrepreneurs has successfully replicated and scaled its model across multiple countries, demonstrating readiness for further expansion. Working closely with national and local leadership in all target countries, Healthy Entrepreneurs has developed systems, standard operating procedures, and used data-driven decision-making to deploy and develop operations that can be aligned with local contexts. Healthy Entrepreneurs' innovative, sustainable, and honest approach is unique in the world of development work. More than 15,000 entrepreneurs reach more than 18 million men, women, and children every year. Come join us.